All right, welcome everyone to the 50th birthday party of Medicare and Medicaid. So, today we're all going to learn about the history of this program and how it has taken the people of this country to make sure that we have this. No one gave us Medicare. People fought for Medicare and Medicaid. And we have to continue to be united to keep Medicare and Medicaid.
Yeah, that's right. So my name is Turi. It's a Swedish name, my grandfather's name. It's pronounced Turi. Like, don't worry, we're in a hurry to get Medicare for all. 50 years, it's a great accomplishment. And as people have mentioned before, it happened because of people like us. It wasn't big interests or special interests that fought for this. It was people, working class people, that said, we need this as a human right. But it is under attack. It's been under attack since its creation. So Eisenhower, when he said that we need Social Security, to protect us for our most vulnerable patients, but also just as to keep the middle class and keep people from going into poverty. So we also need this as part of the plan to have a healthcare for all. But because of the ADA, the doctors really, and the insurance company, they said no. And then Truman tried to do it too. And the insurance companies again said no. This is special interest weighing in on our well-being. And this has been happening since the beginning of healthcare. So then 50 years ago, August 30th, 1965, 50 years ago, we were now guaranteed a little bit more dignity. But it's under attack. So when we say protect, improve, and expand, those are really, really important things that we all agree upon. Protect, I mean, every time that Donald Trump speaks, he's attacking us. He's attacking what we've been fighting for. Improve. Well, the costs of it right now are unsustainable. 40% of the state's budget and about 26% of the national GDP is going to healthcare. On the current rate, by 2025, it will be 100% of GDP. So all of the services will be cut. The sustainability of it is a real problem. So one way to improve it is also to talk about, co-pays, deductibles. These are things that make access to healthcare a real barrier for people. So we're talking about small changes to really big changes, and the expansion, and that's what I want to talk about, is the expansion. The best way to protect Medicare and Medicaid is to expand it for all. And when 50 years ago, when Medicare came out, 19 million people that year signed up. We currently have 55 million people that receive benefits. And we didn't fall off the face of the planet. I mean, if anything, our health and our well-being has been improved. When they say to reduce this, what are they talking about? They're talking about reducing our livelihoods, our ability to be healthy, yet to be alive. So I just want to talk about, well, what is the likelihood about getting a single payer or Medicare for all in America? People have to say that this is possible, this is a priority. New York State just passed it in their assembly. When Vermont passed it, they were like, well, Vermont's adorable. There's 4 people up there and they all love each other. But when New York passes it, well, they're a real economy of scale. So if New York can lead it, why can't Massachusetts have it? Can't?
I recently had to pay $137 for an eye exam. Because I have retinopathy of prematurity. I'm legally blind in one eye. So, got a lot of challenges. So consequently, I'm paying around $583 a month on $1,400 income. And it's a hard way to get by. I got to use credit cards for groceries. I go to church meals. I do everything I can. I don't live high off the hog. I don't have cable. It's like I got to watch every cent. So this campaign is very important, not just for me, but for thousands of people like me who are in the same situation, who are living, right around the poverty line. The last thing I want to say is that We have to protect Social Security, Medicare, Medicaid, and everything that we have because it's under attack. And if we don't work to protect what we have, they're going to take it away from us. I live in subsidized housing. My subsidized housing, elderly disabled housing, gives me affordable rent. If it wasn't for the fact that I had that affordable rent, I could not afford to pay market rate rent. So I would be forced to choose between being homeless and living in a shelter or paying all this out-of-pocket expenses to have access to health care. It's a no-win situation, either way you look at it. So please, if you're not in the campaign, join the campaign. Medicare for all, everybody in, nobody out. Thank you very much.
Okay. George Bayers, could you speak about the celebration?
Well, we're celebrating 50 years of Medicare, and for millions of people in this country, Medicare has been a lifesaver for all of them. Now, we have a legislator that wants to cut everything, and we need to fight that as best we can. Call them, write letters, bug them at home, do whatever we can to get them to stop the cuts. And one other thing I want to say, we miss you, Howard McGowan. Thank you.